Alberta Health Services. Healthy Albertans, healthy communities, together.
Good morning, everyone. I am Gregory Turnbull, Chair of the Alberta Health Services Board, and I would like to welcome you to this AHS Special Public Board meeting. Thank you for taking the time to join us. This is a meeting of the Board to consider one motion. To start, in the spirit of promoting reconciliation and gratitude, and in keeping with the calls to action from the Truth and Reconciliation Commission, on behalf of the Board, I would like to take this opportunity to acknowledge that the work of Alberta Health Services takes place on the historical and contemporary Indigenous lands, including the territories of Treaties 6, 7, and 8, and the homeland of the Métis. I would also like to acknowledge the 46 First Nations communities within what we call Alberta, as well as the Métis and Inuit peoples, who form an important part of our healthcare system. We are grateful to those who have come before us, and mindful of those who will follow us as we steward and protect these lands. Before we get to the business of the day, I'd like to share a few thoughts, and then I will ask Dr. Verna Yu to share with us prior to the business part of the meeting. First, this is my first meeting as chair of the AHS Board. I'm pleased to be part of this governance body of Alberta Health Services, and I look forward to working with members of this board, as well as with the leadership teams across the organization. There is much work to be done. We must continue to respond quickly and nimbly to the ongoing pandemic. At the same time, we must also make progress towards the goals outlined by the Minister of Health, including reducing surgical wait lists by increasing surgical capacity, creating additional permanent inpatient capacity in our hospitals, and continuing to find operational efficiencies within the system. In my new role, I'll work to support AHS to achieve these goals and to keep listening to and working with people in communities across the province to ensure all Albertans have access to safe, high-quality healthcare services. That's why we're all here. I would like to sincerely thank the staff, physicians, and volunteers of AHS who, over the course of 22 difficult and challenging months of pandemic, continue to support Albertans across the province. Their efforts are appreciated, not just by this board, but by all Albertans, and I hope they have time over the holiday season to rest, recharge, and spend time with family and loved ones. For those who are working over the holiday season, please know that we are so grateful for all that you do. Dr. Yu, over to you.
Great. Thanks very much, Greg, and good morning to everyone. And first, I want to start by welcoming Greg to you in your new role as the AHS Board Chair. On behalf of AHS staff and leadership, thank you so much, and we look forward to working with you. We have a lot of work ahead of us, and we appreciate the guidance and support that we receive from all members of the board. This is the second holiday season of the pandemic, and I hope that all Albertans have an opportunity to enjoy some happy and safe time with their loved ones. This includes our staff, physicians, and volunteers, all of whom have worked many long, difficult, and often stressful hours during the course of this pandemic. I'd also like to thank those healthcare workers who may be sacrificing time with their own loved ones to care for Albertans over the holidays. You truly represent the spirit of giving and goodwill. But all Albertans can do their part to care for others, and they can do so by making the decision to get fully immunized. We're seeing increasing numbers of Omicron variant cases in Canada and in Alberta, and immunization is the critical tool to slow its spread, to protect yourselves and others, and to avoid a fifth wave of the pandemic. It's no secret that the fourth wave put unprecedented pressure on the health system this past fall. And I hope that Albertans do everything in their power to help us avoid a similar or even worse situation. Immunization is the only way for us to get through this pandemic. So I urge all eligible Albertans who are not fully vaccinated to get fully vaccinated. You can book your appointment by calling HealthLink at 811 or by using the online booking tool that you can find at alberta.ca/vaccine. As you may have heard, the government announced earlier this morning the expansion of booster shot eligibility. All Albertans ages 50 and older and all healthcare workers who are 6 months or more from their second dose can now book to receive a third dose of an mRNA COVID-19 vaccine to increase the protection against the virus. This will make up to about 700,000 more Albertans eligible to book boosters, and that's welcome news. There's emerging information about third doses being more effective against the Omicron variant, so I encourage Albertans to get their third dose as soon as they are eligible. And I also urge all healthcare workers to get their third doses as well to protect themselves, patients, families, and their colleagues. Again, you can book third doses through HealthLink at 811 or by going online at alberta.ca/vaccine. We also know that immunization also offers good protection against severe disease and hospitalization. More than 3,200 Albertans have passed away from COVID-19, and I keep thinking about all the families who will be missing loved ones this holiday season. Through immunization, we can do our part to protect each other and reduce sickness and death. Thank you to all, and I wish Albertans all the best in the final weeks of 2021. And back over to you, Greg.
Thank you, Verna. We are participating by teleconference today. When I ask for a vote on the motion, I will ask for those opposed or abstaining. For those who neither oppose nor abstain, I will take that you are in favor of the motion. If there are none or a minority who either oppose or abstain, I will declare the motion carried. May I ask that someone move approval of the agenda that has been circulated?
Tony Dagnoni approves the agenda as circulated.
Thank you, Tony. Will someone second the motion?
Sherry Fountain, I so second the motion.
Thank you. Any further discussion? Any opposed or abstentions? Hearing none, I declare the motion is carried. Based on the approved agenda, do any board members have a conflict of interest that they would like to declare at this time? Hearing none, we will move on. I ask Vicki Yellow Oldwoman, Chair of the Community Engagement Committee, to present the motion arising from that committee.
Thank you, Chair. The Community Engagement Committee met on December 15th, 2021. The committee considered amendments to the amended bylaw for Alberta Health Services establishing health advisory councils for recommendation for approval of the board. The amendments address the board's delegation of the authority under Section 7 of the Community Health Council's regulation to terminate the appointment of advisory council members and the change in frequency of health advisory council meetings and events. The board has considered such recommendation and the members support its approval. Accordingly, I move that the Alberta Health Services Board, 1, delegate the authority under Section 7 of the Community Health Council's regulation to terminate the appointment of members of a Community Health Council to the Alberta Health Services Vice President, Community Engagement and Communications. 2, approve the proposed amendments reviewed by the committee and the board to the amended bylaw for Alberta Health Services establishing health advisory councils. And 3, direct the Alberta Health Services Board Chair to sign the amended bylaws to reflect the approved amendments and submit the same to the Minister of Health for approval. I so move.
Thank you, Vicki. Will someone second the motion?
It's Hartley Harris. I'll second the motion.
Great. Thank you, Hartley. Any further discussion on the motion? Anyone opposed or abstaining? Hearing none, the motion is carried. We have reached the end of our agenda. I declare the business meeting adjourned. Thank you for joining us, and please be well and safe. Thank you.
Together, we do amazing things every day.